IMCAS Academy. This is for free. You can only to put your profile, and you can go ahead with this all 32,000 members, 80,000 videos, 8,000 videos, sorry. You have live webinars, clinical case reports, and etc. When you go inside, you can choose different kind of groups of injectable treatment, and treat, laser, ABD, genital treatment, plastic surgery, and clinical dermatology. You need only to ask the permission to go inside the group, and in 24 hours they give you this permission. There are many clever guys in all these groups that for sure give you a solution in minutes, not hours, in minutes. There's a lot of proof of that. You can go inside and select anyone. You don't need to put your own complication. You can learn for the complication for the colleague. And the other important thing is you can be anonymous, because some cases we are shy to put our name and share our complication, but you can do it by anonymous way, and you can obtain many advices from people around the world, for the East, for the West, Europe, Asia, etc. And they are board in all these groups that they are the duty to answer in less than 24 hours. That's why, for sure, you can obtain a good answer to your problem. This is the step-by-step. You need to open your account. Then you can share your complication, inquiry, discussion, or report. And, of course, there are medical ethics. Okay, we need to treat polite between us. We not mention bias or any kind of trademark, because it's not fair. Well, my first case is a patient, 12 years old, female, complained in the post-burn scar a year ago. He used topical silicone with mild improvement. Treatment approach was started with PDL, combination with fractional CO2. After fractional CO2, laser topical with 5U was applied for hypertrophic part, and transepidermal drug delivery. We reached this result after 5 sessions of PDL in combination with fractional CO2. Intradermal microbotox was injected for the resistant hypertrophy part. A strict sun protection and silicone gel is used between sessions. It's a colleague from Egypt, Hamed Nagati. And the question is, what is your recommendation for other treatment approach to improve skin quality of the remaining scar? And this is the case. And this is a trick, because it's perfect. There's no complication over here. I use it nowadays to my colleagues to say, look, what can I reach with the CO2 treatment? CO2 treatment plus FIU, plus Botox, plus many things. And this is our advice and our answer. Well, Sajam Qureshi is from India. He said, thank you for sharing this case. I think you already have done an amazing job from what have achieved. Also, the future plan is gain very, for this case, let me see what he suggests. He suggests microneedle radiofrequency. Ricardo Galvan, unfortunately, he don't here with us. Excellent result, and he offered LAOB. And I said, no, you are make a good work. You need to be happy. Your patient need to be happy, and no, you don't need to do nothing more than that. And another colleague give a big applause for this kind of result. That's why, in this case, it's a trick. I only share with you to mention the limits of our treatment with CO2. Here is a real problem. Papillary scar after laser treatment, okay? It's for France. He is anonymous, a female, 60 years old, a good health. Let me use the microphone. because I can see well. Well, the patient came to my office asking for a treatment for 2 scar in the cheek resulting from the laser treatment performed a month ago. Probably it was Ninuya laser for rosacea. How will you approach this hypertrophic scar if she's not willing to undergo a new laser procedure? What will be the best alternative? Thank you so much. Here is a better photo. Here is the lesions, symmetrical. The patient, the colleague mentioned and asked a solution. Before go to the advice of the speakers, of the expert, what do you think we can do with this patient? Well, plasma here for here. You. CO2. Okay, you. Microneedle. Why not? You. CO2. CO2 have 2 votes. You. 3 votes. And substitution. You add another goal. Perfect. You. With kind of laser therapy? With kind? Photostimulation. Take time. Perfect. You. Biostimulation. Okay. And microneedle. Well, there's a lot of possibility, you know? It's amazing. Here is only 20 people, and we have different kind of point of view. Manuel, what did you suggest for a solution for this girl? Surgical excision. You will be more aggressive than the rest. Okay, let me see. I agree. Sorry, but I agree with your assessment. She agreed with the cause of the problem. Since she's only 1 month of injury, excellent. Scar rehabilitation since treating early. Non-ablative laser. The first opinion was non-ablative laser. And of course, mention the CO2, Arian Yak, etc., etc. Well, in this first opinion was make laser, especially non-ablative laser or CO2 laser. The second, look the colleague, the first one from Canada and the second one from Egypt. And here he talked about the PDL. When you again the PDL, a scar substitution, as a colleague mentioned here, and put filler injection to try to solve the hole. Okay, again, and here is many and many and many. If you have the problem, during several weeks, you still have more and more opinions. Here is from France. Well, he write in France, okay, in French. L'excision is, he goal standard for that. Excision and suture as revision, as Manuel tell us during a few minutes ago. And here I am. First, I will warm to the patient, scar revision to rest. Well, in fact, I said, be calm, wait. This is my simple message about future requests of future result. I always mention that you want to leave a scar, of course. Always saying that because you have to take the problem to the patient, not to you. I mentioned the possibility of technology as CO2, microneedle too, all put a filler to try to put in the correct position these lesions. Well, this is the way it works. This is the way, if you look for any problem in IMCAS ALERT, you can so many advices and so many possibility of result. And the important part is asking to the colleague who put the problem to put after that the solution or the evolution of the patient, because many times they don't have the possibility to notice well if there are any kind of improvement or not. But this is the way it works, and this is what I want to share with you today. Continue for the rest. Jaisa Costa?